Okay, so Zachary's problem is that he's got crossing of the eyes. This is not just one eye. The eyes are crossed relative to one another. We call this esotropia. Now, esotropia is mainly a problem because the two eyes are not looking at the same thing at one time. So right now, he can only use one eye at a time, and so he goes back and forth. One minute he'll use the left eye, the next minute he'll use the right eye. He tends to prefer the left eye a little bit, so it makes it look more often like the right eye is the one that's crossing. But they're both crossed relative to one another. When he's using the right eye, it looks like the left eye is crossed. The problem with this is that he's not using both eyes together. We are not born with the ability to use both eyes together. It is something we learn in the first 2 to 3 years of life. If our eyes are not straight during those first 2 to 3 years of life, we will never, ever learn to use both eyes together. The problem with that is, in using both eyes together is where we develop depth perception. And so, if he doesn't have straight eyes in the near future and keep them straight, then he will never have depth perception. Now, many people go through life without depth perception, and it's not the worst thing in the world. But in a child who has developmental delay, especially delayed motor skills, it is more problematic because they're already going to be delayed in learning to walk and crawl and so forth. And if they don't have depth perception, it's going to be even more delayed. So that's the main reason to try and get the eyes straight as soon as we can. But to get the eyes straight, it will require surgery on the eye muscles. There's no other way to get the eyes straight. There's no glasses, there's no medicine, there's no exercises that will make the eyes straight with this particular problem. Now, we can do surgery when he's much older and still get the eyes straight, but it'll be way too late for him to learn to use both eyes together if we do that. So if we wait till later to do it, it will be purely a cosmetic operation. If we want it to have a benefit for his vision, we have to do it soon. The surgery is pretty straightforward. To do the surgery, what we do is I will show you on this model. So this is a model of the right eye. The muscles, this is the nose here. The bone's been cut away so you can see the muscles. The muscles attach on the front part of the eye, on the white part of the eye. The blood vessels that in your eye actually run through the muscles. So when your eyes get bloodshot, you're actually seeing the muscles. Normally they're transparent, but when your eyes get bloodshot, you're actually seeing the muscles. So to fix this problem, what we do is we operate on the muscle on the inside of the eye that pulls the eye in. And what we do is we cut that muscle off with little tiny scissors. We move it back a few millimeters. We sew it back down with stitches that are absorbed. You can't see them or feel them, and they disappear on their own. And that allows each eye to turn out a little bit so that the eye is perfectly straight. The chances of getting the eye perfectly straight with one operation is about 80%. About 20% of kids are a little bit undercorrected or overcorrected, and we need to go back and adjust them.
Okay.
The risks of the surgery are very few. First of all, this is a painless operation. We do this surgery on adults with them awake. Okay? The reason it's painless is because there's no pain fibers on the white part of the eye. In fact, we can stick a needle in this part of the eye and you won't even feel it without any numbing medicine. Okay? And we do that all the time in adults for treating macular degeneration and so forth, right in the office. But with a child, we have to put them to sleep so they don't move while we're doing the surgery. Now, if you touch the front part of the eye, where the clear part of the eye is, then that's extremely painful, but we don't touch that part of the eye during the surgery. So to do the surgery, we simply pull the eye over a little bit with just using our hands, and then we operate on the muscle right here, move it back, and sew it down. There's a little thin, clear membrane that covers the white part of the eye, which is what makes the eye appear shiny. That's about as thick as tissue paper. We cut through that to get to the muscle. And then we sew that shut with stitches that are absorbed, and they're so small you can't see them. But that heals up in one day. Most children who are school age who have the surgery go back to school the next day.
Okay.
What are the risks? One, when we cut the muscle, we have to always cut the blood vessels that run in the muscle. And so there's always going to be a little bit of bleeding right in this area. So the white part of the eye right here is going to be red. And just like a bruise, it takes about 3 weeks to go away. More severe bleeding is really rare and usually occurs in children who have a known bleeding problem, which he doesn't have. Next, anytime we operate anywhere on the body, there's a risk of getting an infection. And if you get an infection in the eye, it can be dangerous for the eye. Consequently, I have to have you put antibiotic eye drops in the eye after the surgery to prevent infection. And I also have to see him 1 or 2 days later to make sure there's no infection. Okay? I've never seen a dangerous infection in anybody, but it could always happen. I've never seen an infection in anybody who used the eye drops, but it could always happen. Last, because I'm not operating inside the eye, I'm operating on the outside of the eye, the chances of damaging the vision in any way is almost zero. Obviously, anytime you're operating on the eye, something could go wrong that you don't expect that could damage the vision, but that has to be extremely rare. I've never seen that happen. So that's all the risks of the surgery itself. The only other risks are the risk of anesthesia. We have to put him to sleep to do this. If he has an allergic reaction to anesthesia, it can be dangerous, even life-threatening. The chances of a serious allergic reaction to anesthesia is really rare. I've also never seen that happen, but the estimates I've heard are something like 1 in 20,000 in children who've never had surgery before. So that's all the risks of the surgery itself. The alternatives are to do nothing, in which case he will not ever develop the ability to use both eyes together, or do it when he's much older, in which case he still won't develop the use of both eyes together. Just because we get it perfectly straight with surgery isn't going to guarantee that he's going to learn to use both eyes together. That depends on his brain and how much it's ready to learn to use both eyes together. But my feeling is we should give him the opportunity, because if we don't get the eye straight, he will not have the opportunity to do that. So that's pretty much it. Do you have any questions for me?
No, I don't. I'll play it for my wife.
Okay, great.
Thank you. Thank you.